Today we are stepping back to take a hard look at the mistakes and missteps having been made in addressing this pandemic, and what we have learned that might help us better manage this and the next pandemic.
And we have only a few therapeutics in our arsenal. And that means that the things we need to do in order to keep the virus from spreading are really up to us. And it's difficult and it's challenging to comply with social distancing and mask wearing and all of the things we need to do to slow down this virus. It's hard to get everyone to do that. Now, if we were to return to those community mitigation stay-at-home measures, I don't think it needs to look like it did in the spring. We've learned a lot about how this virus spreads, and I think we can use that to our advantage to be more precise in our closures. I don't think we will return to closing outdoor areas or even things like retail businesses with some modifications. But I think it's very possible that places that are experiencing a resurgence will need to close bars, maybe indoor restaurants, maybe schools if we determine that schools are drivers of transmission. So I think there is potential for those high-risk settings to be stepped back.
Social and political determinants of health and how we've done things have been major. I live in the state of Michigan. Wearing a mask has basically become a political statement. It's a statement of freedom and choice, et cetera. And so some of these social and political determinants, I feel like, have overpowered the voice of good science and good medicine and good public health. And so I do think it's important as we consider that this health crisis in large part has been fueled by social and political factors.
One of the things that a lot of people, I think, ask me all the time is, what do you think about the European vaccine versus the American vaccine versus a Chinese vaccine? And one of the points that Dr. Furr-Holden just made, which is that there is no American vaccine, there is no Chinese vaccine, that the scientific community is deeply global and we're all learning from each other. And so it may be that there's a company based in the United States or Europe or China, but the intellectual knowledge that goes underneath that is all through shared work. Science is incredibly collaborative and it is incredibly global.